It is time now for Morning Rounds with CBS News contributor Dr. Holly Phillips and orthopedic surgeon Dr. Neil Roth. Neil is a sports medicine specialist and has served on the medical staff for several professional teams. So first up, football and concussions. Concern over head injuries is dominating all levels of the sport, and the CDC plans a rigorous evaluation of the risks of tackling in youth football. One study found that 1 in 30 players ages 5 to 14 will suffer a concussion during any one season. I still think, despite all of this talk, some people don't even really know how to evaluate if they've had a concussion. What is it?
Right. Concussions actually can be confusing, but I'm so glad there's this increased awareness. It'll help our young people. It'll help athletes. It'll clear up a lot of misconceptions. So concussion actually comes from a Latin term that means to shake violently, and that's essentially what it is. Concussions happen after a sudden and violent blow to the head. So our brain is made of soft tissue. It is cushioned by cerebrospinal fluid inside of the skull. The impact from a sudden blow to the head can jolt the brain or sometimes physically move it within the skull. So that results in bruising, damage to blood vessels, damage to nerves, and the ultimate effect of that is that the brain doesn't function normally, whether that's for a period of days, weeks, or months. There can be a huge number of symptoms just ranging from nausea or vision disturbances, and we're understanding more and more that concussions can affect your mood or even your personality. We see depression, we see changes in the way people behave.
So, Neil, I know from having had a concussion that didn't really show itself, the effects, for about a week to 10 days later, that it can be complicated to know whether you had one. How do you actually diagnose a concussion?
So it's a great question, and concussions are like snowflakes. They're different all the time. There's really no two that are alike. And as we were alluding to, the brain, which basically controls every function of our body, it can manifest itself in a lot of different ways. You can have some dizziness, you could have headaches, which are some of the more obvious, but you can have more subtle findings with mood changes and things along those lines. So the real way to diagnose it is to, number one, know your kid, know your athlete, and if something just does not seem right, then that's a pretty good indication that something could be wrong and you could have a concussion. Doesn't mean you necessarily have to, but it certainly would warrant having it worked up and being looked at. But the best way to really diagnose it is we do these pre-season evaluations, we do baseline testing, there are a lot of neurocognitive tests, there are balance tests that are done pre-season, so in the event that an athlete gets a concussion, we can evaluate it to where they were at their baseline and monitor their progress and additionally monitor the severity of the concussion itself.
I have to say, though, as a parent, it makes me nervous that I should notice certain things and that the symptoms could always be different. Is there a way for there to be some definitive diagnostic tools? Sure. Is that something in the works?
There's a lot of work going on in that area. Just this past week at the American Academy of Neurology conference, some researchers presented a small but very promising study using something called a transcranial Doppler. Excuse me. They developed basically a device where you can put it on the head. It does a Doppler ultrasound of the brain, which measures blood flow. What they found was that it was 83% accurate in distinguishing between high school students that had concussions and high school students that had healthy brains. The point of all of this, and other research like it, is to try to develop some type of device or diagnostic tool that is fast, that's portable, and it's accurate, and it can be used right on the sidelines, right on the sidelines of the game. Neil, I know you were a team doctor for the LA Lakers. If you just had a quickie device right there on the sidelines, I'm sure that would have been a big help.
Of course, in an ideal world, if we had these portable devices that were reliable and gave us, instant information, that would be fantastic. But the fact remains that concussions are very subtle, sometimes findings, and athletic trainers, parents, coaches need to know your athlete and be able to see what's going on. And then, obviously, we've spoken about how the brain is a metabolic type of organism, and if it basically has a concussion, the metabolism is altered, and a brain flow study or something along those lines would be the crux of being able to diagnose that.
Okay. Next up, a problem that sidelines many elite athletes. Of course, back spasms don't only affect the pros. Millions of Americans suffer from the painful muscle contractions each year. Neil, what actually causes this?
Well, back spasm is an end result of sort of irritating one of the nerves in your lower back. And so it can happen from our everyday activities, from an impact, from an athletic maneuver, from doing something very strenuous. And in turn, the nerve will send an impulse to the muscle, and the muscle sees this constant on signal and goes into spasm because it's basically turning it on. Sort of like you were flicking a light switch on and off, it would almost seem as though the light switch is on, that the light is on all the time.
Yeah.
And so the muscles go into spasm, and it becomes very painful and debilitating.
I'm convinced the baby Bjorn led to my back spasms. Because I always would get a massage, like when it was really, really intense. What are the best treatments? What should you be doing?
Right, a massage is a very good one. My oldest childhood friend called me every day this week. She was suffering from terrible back spasms, and she said, "What's the treatment?" And there really isn't a quick fix. What I can say is that using heat and cold therapy is important. Medications we use very judiciously, just some anti-inflammatories, muscle relaxants. We try by all means necessary not to use heavy-duty medications like the opioid painkillers or anything else. Massage, acupuncture, stretching, yoga, all of these things are really keys to getting better. And then strengthening your core and your low back muscles is critical so you don't re-injure yourself.
Well, spasms are just one symptom from those who suffer from chronic back pain. A study of 342 patients by researchers in Seattle points to a potentially helpful treatment: meditation. It found those who engaged in yoga and mindfulness-based meditation had a 61% improvement in the activities they could do compared to 44% who stuck to their normal routines. The meditation group also reported a 55% improvement in pain compared to just 27% in normal care. Mind over matter, a little bit of that,
Very much so. Very much so.
And we're talking about how the brain, with how it affects concussions. It would certainly follow that you have a complete connection on the physical nature of back issues that are tied to your brain, that are tied to your mood, your stress levels. There are hormonal changes that occur that can obviously affect, with stress levels, that will affect your entire, muscular, approach to things. So it's a great connection, and one that, obviously should be incorporated into any type of therapeutic regimen.
All right, Dr. Neil Roth, Dr. Holly Phillips, thank you both very much for being with us.